What do you mean by Ahara Shaktitah Pariksha? What is the significance of Ahara Shaktitah Pariksha? This is the topic of discussion in this particular video. Dear ANA community, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When you think about the Ahara Shaktitah Pariksha, it is the discussion mentioned in Charaka Samhita in the context of Dashavidha Atura Pariksha. It is being mentioned in the Dashavidha Atura Pariksha, Prakrititah Pariksha, Vikrutitah Pariksha, Saratah Pariksha, Samhananatah Pariksha, Pramanatah Pariksha, Satmyatah Pariksha, Sattvatah Pariksha, Ahara Shaktitah Pariksha, Vyayama Shaktitah Pariksha, and Vayatah Pariksha. So, among this, the Ahara Shaktitah Pariksha, actually it is helpful in deciding the digestive capacity of an individual. Whenever if you think about the Ahara Shaktitah Pariksha, the Charaka says, Ahara Shaktitah cha iti, Ahara Shakti, Ahara Shakti, Abhyavaharana Shaktya, Jarana Shaktya cha Pariksha, Balaishi hi Aharayate. So that is Ahara Shakti of an individual that will be assessed by Abhyavaharana Shakti and Jarana Shakti. So here the term Abhyavaharana Shakti refers to the capacity of a consumption of a quantity of the food as such. So here Abhyavaharana Shakti is related to the quantity of an individual, quantity of consumption of food of an individual at a particular time. Whereas in Jarana Shakti, that refers to the ability of the digestion of ingested food. How much time period the food is going to get completely digested. So that will be giving us the Jarana Shakti of an individual. Both are actually helpful in determining the strength of an individual as well as the lifespan of an individual. Both are considered to be mainly dependent upon the quality of the food consumption. Hence, this is considered to be very, very important. So based on the degree of the consumption of the food as such, that will be categorized into Pravara, Madhyama and Avara Ahara Shakti. So we are going to discuss in the coming slides regarding this. When you think about the Abhyavaharana Shakti, basically Abhyavaharana Shakti refers to the quantity of the food consumption at a particular time period. The Ayurveda says, Trividham Kukshau Sthapaye Avakashamsham Aharasya Upayunjana Tadyatha Ekam Avakashamsham Murtanam Aharanam Avikaranam Ekam Dravanam Ekam Punarvataptashleshmanam. So here the three parts are being made. Among that, the one part will be having the consumption that is the mainly containing the solid food portion, whereas the second part that is going to have the liquid portion, and the third part that will be kept vacant for the movement of the what do you say that the dosha as such in the Mahaslokas. But nowadays, what's happening? So this particular three different parts, so that will be totally being ignored. Some of the individuals, they are going to consume the food substances even full stomach capacity, sometimes even up to the esophagus. So this particular food consumption may be there. So this is actually responsible for the total, what do you say, that the Mandagni, thereby the person may have the ama formation. As far as Jarana Shakti is concerned, it is being mentioned that is the digestive capacity. So that will be identified by the Lakshana. That is Udgara Shuddhir Utsaho Vegotsargo Yathochita Laghutakshuk Pipasacha Jirnaharasya Lakshanam. So that is considered to be Jirnahara. That is the complete digestion of the food that can be identified by the features such as Udgara Shuddhi. So the term Udgara Shuddhi refers to the belching, which is having the clear belching. That will not be having any kind of the taste in the what do you say that the belching. Either it may be either Amla Rasatva or it may be Lavana Rasatva, Katu Tikta or Madhura Rasatva, that will be absent. Utsaha, proper enthusiasm of an individual can be maintained. Vegotsargo, proper evacuation of the Vega, such as Mutra, Purisha, etc. So that will be properly moving. So that means the person will be having the proper bowel movements, proper maturation, etc. That will be observed. Lakhuta, he will be having lightness of the body. And Shukpipasacha, the person will be having the adequate amount of the appetite and thirst at appropriate time period. So this will be deciding the Jarana Shakti as such. Further, whenever if you want to have the Jarana Shakti, he should have the proper Matra Ahara as such. So that means the amount of the food that should be proper. How to identify this Matra Vad Ahara Lakshana? So that will be identified by Kukshe Aprati Pidanam Aharena Hridayasya Navarodaha Parshvayo Revatanam Anati Gauravam Udarasya Prenanam Indriyanam Kshutpipasa Uparamaha Sthana Sana Shayana Gamana Uchvasa Prashwasa Hasya Sankatasu Sukana Vrittehi Sayam Pratascha Sukhena Parinamanam Balavarna Upachaya Karatvam Cha Iti Matravado Lakshanam Aharasya Bhavati. So these are the Lakshana that are indicative of the Matravad Ahara. When the person is going to consume the Matravad Ahara, he will be having the proper Jirna Ahara Lakshana. So the Lakshana that are being mentioned, Kukshe Apradi Pidana Maharena. So that means he will not be having any kind of the discomfort in the abdomen after the consumption of food. So the Yasya Anavarodaha, less pressure on the chest as that will be observed. Parshvayo Avipatanam, no specific pain on sides of the chest that can be seen. Anati Gaurabam Udarasya, some amount of the heaviness that may be observed, but undue heaviness that will be absent. Undue heaviness of the abdomen will be absent. Prenanam Indriyanam, proper nourishment of the Indriya will be taking place. Thereby there will be the proper functioning of the Indriyas. Eyes will be doing in the function properly, the vision may be proper, or what we can say the Ghrana, that is the nose that will be doing the functions of the smell as such. So in that way, Kshutpipasa Uparamaha, proper appetite as well as thirst appearance. Sthana Asana Shayana Gamana Uchvasa Prashwasa Hasya Sankathasu Sukhanurti. Whatever may be the activities he is doing, maybe it is sitting, or maybe it is sleeping, or maybe it is moving, maybe it is the respiration. All those activities, he will not be having any kind of the discomfort. Sayam Pratashta Sukhena Parinamanam. Whatever the food substance he is going to consume, that will be digested at proper amount of time. Balavarana Upachaya Karatvam Cha Iti. Properly, the person will be having the adequate strength and adequate complexion, nourishment, etc. that will be attained. This is indicative of a Matravad Ahara. And one person is going to consume such kind of the Ahara, he will be having the Jirna Ahara. Coming to the degree of Pravara, Madhyama and Avaratva. When you consider the person who is having the digestion impairment, if it is this aspect, we can say that he will be having the Avara, what you say that the Ahara Shakti. If it is coming in between, say for example 3 to 7, it may be considered to be the Madhyama as such. If the properly digestion is going to take place 1 to 3, if that is the case, then we are going to say the person will be having the Pravara, what do you say that the Ahara Shakti. In the sense, the person will be having the digestion of the food at appropriate time period. Madhyama in the sense, the time period will be comparatively longer, whereas Avara in the sense, the person will not be getting any kind of the hunger throughout the day. That is what is considered to be indicative of Avara Ahara Shakti. The factors to be considered whenever if you are analyzing the Ahara Shakti, so that is Ashtahara Vidhi Visheshayatana has to be analyzed. Prakriti, Karana, Sanyoga, Rashi, Desha, Kala, Upayoga Samstha and Upayokta. That has to be analyzed properly. Plus, we have to think about the method of the food intake, that is Ushnam, अश्निया स्निग्धं मात्रावत् जीर्णे वीर्याविरुद्धम् इष्टदेशे इष्टसर्वोपकरणं नातिद्रुतं नातिविलम्बितम् अजल्पन् अहसन् तन्मना भुञ्जीत आत्मानम् अभिसमीक्ष्य सम्यक्. So that is very specific to a particular individual. For this, you have to refer the Charaka Samhita regarding this particular, what do you say, that the decoding of this particular shloka. If you are going to decode this here, this purpose of this particular video, that may not be served. Hence, so you have to look into that particular shloka in Charaka Samhita. To sum up, Ahara Shakti is considered to be one of the Dashavidha Atura Pariksha. Two components we are going to analyze in assessing the Ahara Shakti. That is Abhyavaharana Shakti. That is the quantity of the food being consumed at a particular time period. Whereas second one, that is Jarana Shakti. That is the capacity of an individual to have the complete digestion of ingested food. Further, Pravara, Madhyama and Avara, a degree of Ahara Shaktitah Pariksha has to be analyzed to know about the strength of an individual. If you are giving any kind of the medicine, he is able to withstand the power of that particular medicine adequately or not. That can be analyzed by looking into the Pravara, Madhyama and Avara Ahara Shakti as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video they'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video.